Hi, I'm Dr. Kurt Wohler for Sunrise Functional Medicine. The title of this educational video is Hair Metals Test, also called the Hair Toxic and Essential Elements Test. So here's our disclaimer, understanding that this information is for educational purposes only. So the Hair Metals Test, which you can get from a number of different companies, we tend to use in our practice the test from Mosaic Diagnostics, which is very similar to Doctor's Data Laboratory. This assesses for the presence of heavy metals like mercury, lead, arsenic, cadmium in the hair, and then essential elements. These would be minerals, for example. And this gives a direct assessment of the heavy metal exposure that generally is considered to be occurring over time, as well as mineral levels as well. And so what's nice about the hair analysis is it provides information about past exposure as well as certain mineral imbalances which can occur because of the presence of certain heavy metals. Like mercury, for example, can create different kinds of imbalances that you might see in the minerals section of the test. Now, the hair metal test, just like other tests that are detecting the presence of chemicals or mycotoxins, these are providing an assessment for exposure, but they're not defining an illness, for example, that might occur from the presence of those heavy metals. Now, one of the challenges with metal testing is there is no one perfect test, and that's the reality is that many of these metals get distributed throughout the body, and so they can be found in the blood, they can be found in different tissues. So again, there's just not one perfect test, for all circumstances. But the hair metal test is a pretty good place to start in my assessment as a screening assessment, particularly for kids where trying to do blood testing or urine testing can be challenging. So, that's for a longer discussion, but understand that the hair metal test can be used as a screening assessment for just exposure. So remember too that the hair metal test doesn't provide absolute levels of metals in all areas of the body, but instead it is a convenient detection method for environmental and potential body accumulation of metal exposure that might be occurring over time. So many minerals that are assessed on the hair analysis are reflective of body tissue stores, but not for all minerals. So we can't look at every single mineral on the hair analysis and be able to correlate it, for example, 100% with what you might get through blood testing. But it does a pretty decent job for very core minerals, important minerals that are important to test for. And the hair analysis does provide an overall trend of mineral excess and deficiencies, again, for certain minerals, not all minerals, for example, but it's a decent test to assess for these different elements. So here's a typical hair analysis test. We see high levels of various metals. We could have cadmium, lead, mercury, arsenic, aluminum, for example. Sometimes uranium shows up, sometimes thallium, sometimes tin. And these start to become potentially clinically significant when we're in the yellow and certainly the peach or the pink zone, red zone, whatever, where we're starting to get very high levels. And one of the things to also look out for is the total toxic representation bar. When that's elevated, which it is in this particular case, it's really giving you a good insight that there is a high potential of toxicity that might be occurring from certain metals. And that usually is kind of heavily weighted towards things like arsenic and lead and cadmium and mercury, maybe even thallium. And then we see also a variety of minerals that are kind of to the right and to the left of the middle bar, that white bar that runs down through the test. And so there is low values in certain, and there can be sometimes high values in certain minerals. So here we see aluminum high, we see antimony elevated, we've got cadmium and lead that are elevated, and again, the total toxic representation bar. So this is telling us that there has been exposure at some point in the past. It doesn't tell us exactly when or where the exposure is coming from. We just know that it's happened and that there's some accumulation in the body because the hair, through the hair follicle, is a tissue that accumulates metals. So it is a convenient way to assess for past exposure. In some cases, the exposure may be months, if not even longer, in the past. And it also doesn't mean that the levels are indicating current or even ongoing exposure. So again, that has to be teased out clinically by just looking at the individual and their history of where these exposures may come from. Now, one of the things that I've seen over the years that's very useful for doing a hair metal test, or we call it the essential element test, is picking up on low levels of lithium. Now, the companies won't often come out and say that this is 100% concrete proof of a deficiency. So again, it comes down to applying the information to the individual where the test is coming from. However, there have been other tests and studies that have been done over the years that have shown hair as a reflective tissue, or a tissue that's reflective of lithium deficiency. And lithium is actually an important mineral that we need in small amounts to help with brain and nervous system preservation and function. The hippocampus, for example, is greatly dependent on nutritional lithium for its function, and that's important for memory and memory recall and memory retention. What I have found in practice is that low lithium levels picked up on a hair test are often reflective of individuals who have memory issues or anxiety problems. And some of the special needs kids that we work with, it can often be linked to behavioral problems, hyperactivity, hyperexcitability, and in some cases agitation and aggression and self-injurious behavior. That doesn't happen with everybody, but that's a particular concern. So the hair metal test is a convenient screening assessment for heavy metals, the exposure. The best source of hair comes from the scalp, but pubic hair can also be used as well. If somebody has very short hair or somebody's bald, for example, you can get pubic hair. And then based on hair metal levels, additional considerations could be explored. Okay, so blood testing, for example, that sometimes comes up. Let's say there's lead that might be elevated, is to confirm that on blood testing just to make sure that there's not ongoing acute exposure in the environment. And then with the essential elements section of the hair analysis, certain deficiencies can be addressed through, nutrient supplementation, like lithium, for example. You can actually give lithium supplementation, not medication lithium, but lithium supplementation to overcome that potential deficiency state. And then a few minerals like manganese, interestingly enough, when they're elevated, could also be problematic. So manganese can, if it's too high, and it can be another thing that you get exposed to environmentally, can cause stress and oxidative reactions in the brain and nervous system. So the hair test is not only looking at the heavy metals like mercury, lead, cadmium, aluminum, but sometimes certain mineral levels that are too high can be problematic too. Now, you can access your own copy of a hair metal test through a website called LabTest Plus. So LabTest Plus offers a wide variety of different test offerings for integrative and functional medicine test, urine test, stool test, as well as a hair test. And so you can go to labtestplus.com for more information. If you like more information about our consulting practice, the use of this test and others, you can reach out to us at scmedicalcenter@gmail.com. You see the website mysunrisecenter.com. So again, I am Dr. Kurt Wohler for Sunrise Functional Medicine. Thank you.